So community-led monitoring. One is that it is important to note that one of the things that we do is to speak with evidence. So our job is to get data, collect data from services that have been provided in terms of, are they accessible, are they affordable, are they reaching the people, are they of quality, are they respecting human rights, are they respecting gender consideration, and all those from a perspective of the recipient of the services. Now, when we have evidence, our job is then simple: to engage, to inform, to influence, to make sure that programming, policy, program implementation is informed by what we see, what we hear, and how we see it, and how we hear it from the communities. So, PEPFAR team, for example, we guide them in terms of, you've been hearing us and you yourselves making recommendations, suggesting that we need to invest in prevention, we need to invest in adolescent girls and young women. That's what people are telling us at a community level. They are saying this is where the problem is, this is where the challenge is. So when we get into these platforms, we are engaging with decision makers and funders and implementing mechanisms that this is where resources should be. And therefore our job is to make sure that resources are allocated where the gaps are. It is also important to note that one of the things that we do as CLM is to make sure that communities are in places and spaces and platforms like this one to engage directly with people who make decisions, who make policies, and who allocate resources. That's why this morning we had most of us in this room. So our job is to make sure that we give you evidence, we share with you what we are hearing and what monitors are picking, and then you engage from an evidence point of view. So our hope is that the programs that therefore are put in place are responding to their needs. So what we call upon communities is to continue advocating and advocating. And it is important to note that our efforts are really working. We had Carol say when we started advocating for KP, we didn't even know what to do. This was CLM, because we advocated for KP because we knew there was a gap. We were told there was a gap. But we also didn't know how to go about it. But we are glad now that everybody can be happy that the KP model is working and that the KP-led organizations are where they are because evidence that we provided led to programming. The monitors are saying there's no data, and yet when they get to the communities, people they see in the facilities are women with disabilities who are struggling to climb beds, and yet they cannot climb beds, who are getting information and yet they cannot hear. So we pushed for that. And the last one that I can talk about to say why CLM and what we do. Evidence was very clear from the monitors that unless we tackle treatment literacy, we are not doing much. And we advocated for treatment literacy. And we are glad that Nafopanu did a pilot. Now our job as communities is to say pilots are not enough. We need to scale up this model that has worked so that we are able to reach many more people living with HIV, and not only people living with HIV, but in their different diversities. That if you're talking about young people, if you're talking about women and girls, if you're talking about men, the men know how to speak to men. Young people know how to speak to young people. And therefore we cannot take people living with HIV as a homogeneous group. And therefore our call is that now we need to look at how do we make sure that we are reaching the different categories of people living with HIV with treatment literacy led by themselves, so that at the end of the day, we are able to end AIDS by 2030.